Dialogue. Thank you, Senator Sanders and Mr. Secretary, and welcome, Mr. Secretary. It's a good thing I haven't been here all day, or that I'd have way too many things to talk about. But right now, I want to raise an issue related to the discussion you just had. You know, we just passed, under the first Trump administration, we passed the pilot program for Solid Start Act, and then under the Biden administration, we made it a law specifically to get at the issue that I think Senator Sanders was raising about how do you attract or inform veterans more about the opportunities and the benefits that they have at the VA. And so I would just encourage you to look at that and make sure we're managing that well. The other thing I would raise with regard to the workforce, which I think Senator Sanders is right about, and it is true, we have a shortage of people in healthcare everywhere. And to the degree we can incentivize it, I think we ought to. At the same time, and I'm just going to give a little North Dakota example, and Senator Blackburn spoke to it briefly toward the end of her questioning. In North Dakota, in this rectangular spot in the middle of the North American continent that's about 350 miles across and about 200 miles up and down, there are 36 critical access hospitals in rural communities. Now, Fortuna, North Dakota, to Fargo, North Dakota, where the only VA hospital is 412 miles. Takes roughly 6 hours and 19 minutes if you don't stop to go to the bathroom to go from one to the other. But there are these 36 critical access hospitals that have 20 hospital beds each, and maybe 2 or 3 of them are being used at any given time. Senator Blackburn talked about community care. We've talked about the shortage of facilities, shortage of workers and opportunities, and yet there's all of this infrastructure not being used. There's got to be a way to utilize existing infrastructure and actually save money, both for the VA and then create opportunity for these struggling hospitals in rural America.
I don't disagree with you at all, and I think it's actually, Senator Duckworth and I actually had this conversation a long time ago about actually co-locating CBOCs and stuff that we could actually do that. I think that's a great idea as we look at it. But I think one of the things is how we, utilize the Mission Act possibilities that we have. You make sure that we're getting people there. The other problem we have, and this is found not only in some of our facilities, but mainly some in DOD facilities, but also community facilities, it's also an issue of quality care. Yes. It's an issue of our doctors seeing enough patients to keep their clinical skills up, or nurses seeing enough to keep their clinical skills up. That's why I've already been looking at several options, and we're doing this in certain cities now where we can. I'm encouraging every one of our facilities to have understanding agreements with local hospitals, with community hospitals, so where they can go back and forth. We can also look at DOD facilities, which is also a big issue. We have underutilized DOD hospitals, underutilized DOD facilities, in which we could be one of those. Actually, we're looking at right now in Jacksonville, Florida, in which we could actually save our community care costs because we could actually have a DOD facility there. So it's a lot of things we can work on here, but I think it's just a matter of using all the resources that we have.
Right, and that starts with knowing what they all are. That's a great illustration, the one you just made. One of Cramer's convictions is I reject the notion that every transaction requires a loser. We should look for opportunities for winners and winners, and I think that would be one of them. Congratulations, thanks for doing that. I want to get back to the 80,000 thing, and because you've been being battered about it, I think without us acknowledging the other issue. I'm going to stick with a lower number. Correct me if I'm wrong, but I believe there were 52,000 new positions added between 2021 and 2024. Does that sound about right? 52,000 during the Biden administration?
Yes.
Okay. And how has that improved the health care offerings for veterans? Are we seeing a lot more veterans? Is it better care? Is that 52,000, has that really been has that saved the day for our veterans?
Yeah, I don't think so, because I think if you I use it in a different way. If you go back to 2015 when the GAO put us under the high risk, and again, I've been here all of, barely 90 days at this point. Looking at this, I'm using the numbers that we are given, and we can talk about whether the numbers change or anything else. I'm using the numbers that we currently have at VA. Wait times have increased. Primary care, mental health, specialty care, all rose. Disability backlogs. It's not a secret. It was at 260,000 when I came in. It's about 220,000 now. These are just honest numbers, but I want to go back to something at 10 years ago. At 10 years ago, if I had told this committee, and I had told, and I did this at our senior staff, and I told, this is careers and politicals, I said, if I told you that in 2025, you're going to have a budget of almost $400 billion, and you're going to have a workforce of 470,000, you would have thrown a party, everything would have been great, because that would have been the answer to everything. Well, we're 10 years later, and we're still experiencing the same problems.
No, well, I appreciate that.
Servicing the same amount of veterans.
Yeah,
too, by the way.
that's the important point. I appreciate all of that. I do think I think everybody on this committee wants to have an honest discussion about how to do better for our veterans, and that kind of real data can help us, because there's plenty of data there to tell us where we've been okay, where we haven't been so good, and where we've been awful or great. Thank you, Mr. Chairman.
Senator Cramer, thank you. Senator Duckworth.
Thank you, Mr. Chairman. I do think it's important to